guys, it's Lola here and you're welcome to Leaned by Lola. How have you guys been doing? Has been everything? I've been keeping up fine actually. Has been your application with work? Are you a nurse? You're trying to get the tier 2 visa via the healthcare system. Well, has your application been? Have you been getting positive response? Have you been getting good feedbacks? Have you gotten a job yet? If you've been having any challenges or probably you've gotten a job, just say something to me in the comment section. I would be so glad to hear the good news or whatever challenges that you might be facing. All right guys, so today I just want to talk about my work, my role here, what I do, and how things have been generally with me. Well, not generally with me, career wise. I'm not sure so much has been going on with me. Okay, it's just I think that it's just been workflow for me, really. It's just been a lot of workflow. So if it's something that you're interested in, I need you guys to stay tuned and I'll be right back with the gists. Lola. If you're a new subscriber here, thank you so much for subscribing to my channel, and to the old subscribers, thank you so much for sticking around. Yes, thank you so much for sticking around. Okay, and if you have not subscribed, please try to subscribe. I'd really appreciate that. All right guys, so I just wanted to give you guys an update about myself. I don't think I talk about myself more. I'm not sure, but let's just do a bit of me. Let me just try to vent to you guys today. So back while in Nigeria, I used to be a general nurse. Like, in Nigeria, you first of all be a general nurse before you specialize. In the UK here, you can actually specialize before you can actually specialize and never do the general nursing. Like, you can specialize in midwifery and that's okay. You can specialize in mental health nursing and that's fine. You can just choose where you want to start from. So what's my experience as a mental health nurse before now was just going to psychiatric posting, like we call it in Nigeria, because you're not really allowed to use such kind of words here. It's sort of judgmental. Was when I went to Benin, Aro, as a student, just 1 month, say max 2 months postings, clinical placement for those mental health postings. And trust me guys, it was never one of the things I wanted to be. I never wanted to be a mental health nurse. I'm not sure, if I think about it, I'm not sure why, but it was never something it never interested me in any sorts. But I knew that people were really crazy about it. Some people really loved mental. I don't know what you guys like about it though, but it wasn't just my thing. It wasn't my thing at all. And so it was just something like, we need to go for the posting, pass the examinations, and I had brief knowledge of the clinical conditions, the schizophrenia, the bipolars, mania, all of at least. And I know about the drugs also to a large extent, or to a little extent, I would say, based on my new findings. So while I was looking for a job earlier this year, I got a job to work in a mental health unit, but I never fully understood what it was. So I asked a couple of friends, and then they told me that, oh, it's fine, it's okay, you make more money, it's less stressful than the added nursing, blah, 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 blah. Don't worry, get it. I'm like, okay, no problem, I'm gonna get it. And here I am now. And it feels as though when I started, it felt as though I wasn't making the right decision. I know that starting from somewhere, starting fresh in a specialty where you've never considered specializing in, I feel like it could be a lot. It could be very challenging, and trust me, it has been challenging for me. And I'm going to tell you why it's been challenging for me. I think that the role of a mental health nurse here is more administrative. You're more like a clerk, like a lawyer. You're playing the role of a lawyer, an administrator, a clerk, a manager. You're playing that role more than using the actual nursing, the actual nursing skills. The only nursing skill at this point, maybe aside from my psychotherapy skill, that really does matter is my medication skills, like drug administration. At this point, it feels as though that's the only thing I can bring in, and maybe the psychotherapy part that I mentioned, because it's a different ball game entirely, guys. It's so different. Now let me tell you why it's different. You need to learn about the sections. There's what we call the Mental Health Act, and as a mental health nurse in the UK, you should have your Mental Health Act in your palm. Like, you should have it like this. I mean, I don't know all this lot stuff. You should know what the section 3 is, and the Mental Health Act, the section 2, section 136, section 54, section 54. I'm not even sure again. Section 53, section, yeah, that's fine. That's section 54. Section 17, like, you should know the informal patient, the formal patient. You should know your human rights laws. There's just so many laws that you need to know. You should be careful about the kind of things you say. You're not supposed to use a kind of word, because if you use a kind of word for a patient that you would have used conventionally for some other person, they might feel traumatized about that. And you know, when this kind of things get to the court of law, they might be used against you, especially when a doctor, when a lawyer now dissect those kind of words. And I feel like you have higher risk of being litigated. Like, the risk is so high, aside the risk from the hazard of the job, because I feel like the job is hazardous already. All jobs come with its own hazard, trust me, and this kind of role comes totally with its own hazard. But the good thing is, there are body cameras for you to use, there are alarms. You need to, the way you go to the way you have to be dressed is different. You can't wear some kind of earrings as a mental health nurse. Sometimes, depends on the ward you are, you need to wear a body cam just in case something happens, because you're not supposed to hold some patients in some kind of way. In the UK here, they try to use the least restrictive practice as possible because of the human rights laws, and so you have to, you know, so it's different from Nigeria. In Nigeria, you can use the reels, you can use the physical constraint, like you can, you can do that. You can use physical constraint. You can do that in the UK. You can't at least I have never seen it happen. You're not allowed to tie someone's hands to the bed. No, you're not. Even before you use the drug, the person must be on either section 3, where they do not have of the Mental Health Act. So you need to know when you can actually, you know when I did mental health nursing, there was if patient is misbehaving, blah 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 blah, you should just put the drug. You can't do that one for a formal patient here. You will be in trouble. Like, you're gonna be in big trouble. So everything that you're doing as a mental health nurse is actually guided by the law. You need to follow the law, your Mental Health Act. Like, you need to follow it to the letter. So the good thing is, maybe if a mental health nurse is being sued for something, you need to actually use the Mental Health Act to counteract it and everything. But it's a whole lot of learning. Like, it's a whole lot of learning. It's really, I don't want to say too much, but it's a whole lot of learning. And trust me, it's been very, very challenging. But I feel like this week I got more integrated. You know, coming to a new specialty, you just get a bit overwhelmed. But this week I've been like, I feel better integrated into it than other times, and I know that with time it's really going to get better. But I've not made a decision yet if I'm going to stay fully in the mental health nursing. I'm going to go back to my adult nursing. I am not fully. I want to allow myself to learn. Like I said, even though it's really challenging, guys, it's so challenging. Like, you need to be very careful of your choices of words. As much as you need to be firm, you also need to like because somebody can read your communication in a different way, even if you meant it in a better way. And because where I'm coming from a different, background entirely, and having to integrate myself into a different background, into like it's just been challenging for me, but I know that I'll be fine. I'll be okay. I'll get better with it. So if you want to do mental health nursing, even as a mental health nurse from Nigeria, from back home, there are many things you need to consider, but I'm not discouraging you. It's really fun to be, but it's physically and mentally draining. Physically, because sometimes you actually have to run in the sense that if an alarm goes off somewhere, you do not walk because the patient might be at risk of harming themselves. You need to run. So you're not just walking, you're running, and the words are actually very big, so you need to run. So sometimes alarms are buzzing, whether it's a false alarm or whether it's true. You need to run, you need to walk very fast because somebody's life is at risk and you need to do the right thing. Sometimes the patient might be having difficult times, and maybe a face. Some patients might be having some violent behavior. You actually just need to be on your feet. Sometimes you need to be firm, you need to be caring, you need to be loving at the same time. You need to understand, like you need to be empathic. I feel like it just comes with so much. You need to do a lot of documentation. You need to do a lot of incident reporting, witness reporting. You need to document very well, and you need to carry the family along with the care. You need to carry the patient along with the care you're giving. Yeah, that is it. So if you want to come to mental health nursing, please think very well if it's something you want to do, if it's really something you want to do, because the skills are more psychological than even those conventional nursing skills. The skills you're using, they are mental skills. You have to use mental skills to actually deal with those kind of I don't even have the right words, because now I'm it's causing to me I need to be careful of the kind of words I even use on here. You just have to, you understand what I mean. Yeah, so that's just been it. But I know it's fun. I know that some people really enjoy this, and maybe with time I'm going to fully immerse myself into it, and I'll give you guys an update about it. But till then, I'm here taking one day at a time. One day at a time, they say. Yeah, just back and say, to take one step at a time. There's no need to rush. There's no need to rush. I'm taking one day at a time. And quite frankly, I feel really better this week. I feel better. I feel like I'm learning. And by the time I have a grasp of some things, I feel like I will fit into the whole mental health nursing. Yes guys, so I've come to the end of my videos. I've come to the end of my video. If you think you could work in a mental health unit, let me know. If you don't mind making that switch, there are many trusts looking for mental health nurses. Please apply if you see one, and trust me, you might enjoy it. I'm not sure entirely. You might enjoy it, you might not enjoy it, and if you don't enjoy it, please go back to wherever you come from. And that is just it. All right, so I catch you guys next time. Love you guys. Bye.